The exercise will be about making impressions for implant number 12. I hope you had the chance to watch making custom tray. Uh, pay, pay attention, the demonstration video is about making custom tray for a mandibular arch, uh, although we are making impression for the maxillary arch. So pay attention, you're using the maxillary arch to fabricate the tray. And we will talk about the differences now. The spacing amount will be the same, 2 layers of base plate wax. We will have tissue stops on a teeth that you don't want to capture. Even space, so when you put the tray, it doesn't have to rock. The tray shouldn't touch any of the tissues, soft tissues. Only the tissue stops will touch the occlusal surfaces of the teeth. We added some wings. Those wings shouldn't be that long. They are only like 5 millimeter above the body tray, or wider than the body tray. Otherwise you cannot sit in the patient mouth because of they will hit the cheek. You have a handle. This is very convenient to deliver the tray in the patient mouth. If this is maxillary arch, you're gonna reach the patient like that. So always you rotate the impression material and seat it in the patient mouth. I already painted the tray with adhesive. Make sure you are using the right adhesive material. If you're using this brand for your impression, make sure you use the same adhesive, so it will work efficiently and decrease any errors. So as you can see as well, I marked number 12, tooth number 12, and I draw lines extended all the way to the land area. So when I put the tray back, I draw back the line all the way to the tray to estimate where is the hole gonna be. So you're gonna drill this hole based on estimation of number 12 tooth location. So this is give you an accurate hole position. So once you do that, like 1 week before your patient comes to see you, this is ready for making an impression for your implant patient. So your implant patient will come to you presented this way. As you can see, there is a healing abutment during healing, and this is hand torqued. So you will go to the dispensary to check this Straumann kit. There is a torque wrench here, some screwdrivers, different screwdrivers for different purposes, and some abutments, stock abutments here. So we're going to use the screwdriver specifically for Straumann. And looking at the screwdriver head, it looks like a star, and this is very specific for Straumann. All the components of a Straumann company will fit this, should work with this screwdriver. Now, as I said, with hand you will be able to untorque the healing abutment anti-clockwise. This is like very common rule. Anything anti-clockwise, it goes up. Clockwise, it goes down. The thumb rule. So we're gonna anti-clockwise. It's gonna and rotate it, and as you can see, this is a healing abutment, not cover screw. So this is a one-stage surgery. The implant was not covered with soft tissue, and you can see here we are dealing with a bone level implant. You can see the platform is below the soft tissue, and the platform is flush with the bone, and we will distribute that root plug for you guys this Friday. So you're gonna see this root block in the root space, and I recommend to flow light body at the base of that light body PVS at the base of the root block to seal any space between the root block and the typodont. This will make sure you will have stable root block to work with. So we're working, we're gonna do an open tray impression. I ordered the open tray component, and you can see the impression post. If you remember, it's gonna stay in the impression material, so there is aggressive design and retention features in it. And you can see it's very long. It has to stick like above the tray body, so you can access the screw, the impression post screw, and take it out. You can see the screw is going in and out. This impression post for closed tray technique, and this is the impression cap. You can use the same tray but without the hole if you're making closed tray impression. But as I said, there is some drawbacks for that technique. The most accurate way is using the open tray. So I will go ahead and seat the impression post in the patient mouth. So as you know, as you see, there is hex. This is the anti-rotational feature or the internal hex of the implant. So the impression post will not like go indirectly there. See, you feel resistance. You have to rotate it until you feel a drop. Once you feel a drop, you engage the impression screw and gently you start screwing the impression post. The impression post shouldn't touch anything. It shouldn't touch any neighbor teeth. If it does, you have to physically shave the impression post until you have space between the impression post and the teeth. And this is very true with the lower central incisors impression. The space is very tight and you have to shave the impression post sometimes in order to make it seat. So you can see the impression post is way high, so you can tell this is open tray impression post. So before you make the impression, you always try practice or rehearse the impression way and make sure that the impression post will go passively through the hole and the tray is still stable. And sometimes the shoulder of the impression post hits inside here, so you can see I hollowed a little bit around the hole so the shoulder will not make any attach or contact with the tray here. Nice. So for this impression, we're going to use a light body and medium body. Always ask your instructor before you do an impression what material you like. I like, honestly, instead of medium body, I like a heavy body. I need to drink some water. I will be back. I will flow the light body around the critical area, which is, and don't worry, we have plenty of time because of the cold environment here. So the impression post is very tight and secure. Usually we take a radiograph to verify the component seating. Then, before I make the impression, sometimes sometimes what I do, I paint the impression post itself with adhesive. You can see this is adhesive material, not the purple part, it's just the silver part, because I want it to bond chemically with my impression material. I don't want it to move. I just wanted accurate impressions. And this is why I like open tray impression. So you paint the impression post with adhesive, impression adhesive. And I'll start inject my light body. First I have to bleed it. And I will inject light body around the soft tissue, proximal contact. Occlusal surfaces, inguinal side as well. I keep those threads exposed so I can engage them with the medium body or heavy body. I don't want the heavy body is more. So bring the tray, bleed again. Hopefully I have enough material. We'll see. Always the tip inside the tray so you will not create any bubbles inside the impression. When you advance, always warn your patient it's going to be hard to remove the impression. This is why we have the wings on the sides completely filled. And for fixed restorations, we always like horseshoe design, either mandible or maxillary arch. If you're making a denture or a partial denture, we capture the palate, but for this case it's not needed. So we go like that, and we already practiced the seating, so it should be piece of cake. You keep pressing until you engage your tissue stops. Now this is seated. Clinically, I look at the vestibules. Everything is captured and covered. I don't want to see any teeth. All the soft tissue is covered. Now I wipe the impression post screw. Before the material sets. And this is the importance of a small hole. If it's a huge hole, the material will drip in the patient mouth and he will start gagging on you. So I will leave that for 5 minutes and show you what it's gonna look like after that.